It's time to shatter the silence surrounding menopause. The cost of ignoring this natural transition is far too high, impacting health, equity, and economic growth. On World Menopause Day, we must recognize that this is not just a personal struggle, but a societal issue that demands attention. Perimenopause and menopause can span over a decade, affecting over 450 million women worldwide. Research shows that addressing the health gap related to menopause could lead to significant gains in life years and GDP. These improvements translate to fewer sick days, stable incomes, and reduced strain on healthcare systems. But here's where it gets controversial. Despite the need, our systems are ill-prepared. Diagnosis and care are often delayed, inconsistent, or inaccessible. A Yale University review revealed that while 60% of women with menopause symptoms seek treatment, a staggering 75% go untreated. The lack of training among healthcare professionals is a major contributor. In one study, half of family medicine doctors reported receiving only a single lecture on menopause during their training, with 1 in 5 receiving none at all. The impact on the workforce is evident. 1 in 4 women has considered leaving their job during this transition, and 1 in 10 who persevered ended up quitting due to their symptoms. This is not just about productivity, it's about the opportunity cost of losing experienced leaders and the stress it places on families. As an expert member of the World Economic Forum's Global Alliance for Women's Health and an advisor to Halle Berry's menopause care platform, Respin Health, I've seen firsthand how evidence-backed initiatives can transform the conversation. These organizations are translating scientific research into practical clinical standards and employer policies, offering a roadmap for leaders to follow. When we leave women to navigate menopause alone, we sacrifice health, productivity, and our own dignity. We must normalize this conversation, make guidance accessible, and improve access to quality care, says Halle Berry. Healthcare is the first step towards change. Menopause should be integrated into routine primary care, not relegated to specialty services. Screening should begin during regular visits for women in their 40s and 50s, with clear pathways for counseling and treatment. Evidence-based options, including lifestyle approaches, non-hormonal treatments, and hormonal therapies guided by informed choice, should be readily available. Care should also address mental health and cardiometabolic risks, as these often coincide with menopause symptoms. Workplaces play a crucial role in supporting women through menopause. Simple adjustments like flexibility, paid time off for symptom flare-ups, and temperature control can make a significant difference. Benefits packages should explicitly mention menopause, and manager training should encourage support without requiring disclosure. Employers who measure the impact of these practices will find that small investments lead to stable, high-performing teams. Research and product design must address the data gap and raise the bar for solutions. Studies should reflect the diversity of women, considering factors like race, age, and coexisting conditions. Digital tools and consumer products targeting sleep, cognition, and pelvic health should be evaluated against evidence-based standards and priced affordably. Policy and financing can ensure that best practices become the norm. Essential menopause services should be included in national primary health packages and insurance coverage. Governments can encourage employer adoption through clear standards, recognition, and incentives. Public information campaigns can replace stigma with practical knowledge, empowering women, partners, managers, and clinicians. Why does this matter beyond the clinic and workplace? Because prioritizing women's health leads to stronger families and economies. Early diagnosis and treatment reduce absenteeism, and menopause supportive workplaces retain experienced talent. Good care prevents costly complications down the line. The cumulative effect is evident in national productivity, but the most important return is the human one. Better sleep, clearer thinking, and restored confidence. Effective advocacy combines public leadership, technical expertise, and coordinated action. Public figures make the issue relatable. Researchers define quality care, and cross-sector forums align employers, health systems, and governments on practical standards. This is where platforms like the Global Alliance for Women's Health and the International Menopause Society add value, bridging the gap between intention and action. So what should we do now? Health systems can add brief screening and counselling steps to primary care visits and establish simple referral pathways. Medical schools and continuing education providers can enhance training for the next generation of clinicians. Employers can publish menopause policies, train managers, and update benefits to ensure support is accessible. Researchers can design diverse studies with shared endpoints for transparent comparisons. Policymakers can include menopause care in basic benefit packages and require transparent reporting on access and outcomes. Culture change must accompany policy change. Partners can offer non-judgmental support, friends can share their experiences, and community leaders can include menopause in health discussions. The tone, precision, and a well-defined plan are essential to creating an environment where women don't have to struggle alone. World Menopause Day should be more than a yearly reminder. It should be a moment of accountability. Let's ask ourselves, did we make it easier for women to access accurate information, timely care, and practical support this year? If the answer is yes, the benefits will be evident in our communities. The path is clear. Now it's up to us to show the resolve to make a difference. Let's act today so more women can thrive tomorrow.